This uterus is definitely getting top billing right now. What is a contraction? What do they feel like? Tell me more about this uterus. Today we're going to talk about all those things and also how to know if you're going into labor, so stay tuned. Now this one is really important to learn from somebody who's seen a lot of different uteruses because everybody kind of feels contractions a little bit different, but as someone who's been in labor and delivery for 20 years, plus a nurse since 1997, I've definitely seen some commonalities between people. Oh, and did I mention I've had 3 babies of my own? So I have had contractions. I've seen tons of other people have contractions. I'm really an expert on this one, and I'm so glad that you're here. And if you're looking for more resources for your upcoming hospital birth, grab my birth plans made easy. I like to call it birth preferences, but it didn't fit as nice on the sheet. I'll put the link down below. It's going to totally help you start making choices for your upcoming birth. One thing you can't make choices of is when your uterus contracts and how you feel them. So first off, what are contractions? Well, this is your uterus. You have a baby inside your womb, and your uterus is going to start to contract to push that baby out of the womb into the birth canal to be born. That's what contractions are. Your uterus is just a giant muscle, just like these sweet guns right here. Yes, I did work out this morning. I don't think it did anything, but it's just a muscle. So if you think of your uterus as a muscle, you're good to go. The weird thing is it also grows a baby. It's a growing baby plus a muscle. Did you know that your heart is just a muscle though as well? Muscles are very important in our body, but that's what a contraction is. So what do most people think that they feel like? Well, there's 2 things that you've had happen before that I think contractions are pretty similar to. The first one is cramps. Early contractions often feel like that period cramping. No, it's not so fun. Now, that's early contractions. Those tend to get more painful and increase, but a lot of times people, when they're going into labor, will say, I feel kind of like my period's starting, and that can be signs of early labor. Does it mean you're going into labor? Maybe not quite, but that's something you can watch for. And the other thing that you may have had is like stomach cramps, either with food poisoning or a virus. Your stomach cramping is very similar to contractions. Now, when you have the food poisoning or a virus, your body's main goal is to try and get that out of your body. So just like your uterus, your stomach and intestines are contracting to try and get that out of your body, and that is why they feel similar. I honestly feel like those really bad stomach cramps that you sometimes get when you eat the wrong Chinese food are the most similar to contraction pain that you're going to feel. Now, I have a whole post about, is kidney pain worse than contraction pain? I don't think so, because once you get out your kidney stone, you get to have a nap, whereas this one you get to raise a baby. I've also had my appendix rupture, and I actually thought that that was more painful than a contraction, but felt very different. So there you go with what a contraction feels like. But keep watching, because I'm going to talk about some of the most common questions I get about contractions, and it might answer some of the questions that you have. Of course, I hope your uterus isn't the only thing that's growing. The pregnancy nurse is also really trying to grow. So when you guys like this video and subscribe, it really helps our channel grow, and we're really trying to get this information out to more pregnant people. We appreciate each one. And if you've already had a baby and have felt contractions, what did they feel like for you? Tell us down in the comments. Now, where will you feel your contractions? It tends to be that lower belly, although a lot of times it wraps around into the back. I just saw a video on social media of someone who said, nobody ever told me that I might have back labor. And where you feel your contractions really depends on how baby is facing inside the womb. So a lot of times when they're facing forward, that head butts up against the back, and so you'll have more back labor. And then as labor progresses, hopefully baby turns and you get less back labor and more belly labor. But usually you're feeling it around your belly. Pro tip, I think that as labor is progressing, you tend to feel around your whole torso, including your back and your belly, and that can be a sign that you're heading into active labor, or you're not having false labor or Braxton Hicks. I don't know what you guys want to call it, but it shows that maybe something is actually going to get going. And I'm here to tell you that those false starts of labor are so annoying. I have a whole video about it. I'll put the link down below in case you guys want to watch that one. Okay, a lot of people want to know, how do I know if I'm contracting? The reality is some people don't feel all of their contractions, but in general, if you're not feeling the contraction, it's not moving the baby. Now, if you're in a preterm labor zone, you're going to want to ask your provider what you should be watching for. If you're having those cramping feelings or whatever, you definitely want to call your provider or head into labor and delivery. But if you are due, you don't need to be like, is that a contraction or is it the baby moving? A lot of times people feel like early contractions feels like the baby's moving, but usually those contractions are not pushing baby into the birth canal and are something that should trigger you to go to the hospital. So if you're wondering, is that a contraction? You're probably at a point where it doesn't really matter. Just keep monitoring yourself and, maybe you'll get to a point where you're like, okay, that is a contraction, and I promise everyone gets there, or they go away and you move on with your life. Now, a lot of people want to know true labor versus false labor. I have a whole video about that. But honestly, Braxton Hicks contractions can be pretty darn painful. So let's not discount them saying that they're easy. They just don't tend to be as frequent or as long. But I'm here to tell you Braxton Hicks can hurt a lot. They just don't tend to push baby into the birth canal, and they don't progress faster, stronger, harder. I have a whole video about it. I'll put it down below. Now, one of the things I get on one of my websites, and I'll put the link to that post also, is that I'm contracting and it's showing on the monitor in labor and delivery, but I'm not feeling them. What does that mean? Again, like I said, a lot of people will contract without really knowing it because it's not going to be painful. It may just feel some tightening. A lot of times it feels like baby moving. And if it's not unusual for us to pick up contractions that you're not really feeling. And ultimately, most often, those contractions do not put you into labor. But a lot of people see them and think, oh, I'm in labor. And I'm like, no, it could be because you're dehydrated or baby is moving. And I'm here to tell you that your uterus's job is to contract, and it's going to practice doing its job throughout pregnancy. So if you have a contraction here or there, even at 36 weeks, as long as you don't have a follow-up contraction within the next 10 to 20 minutes, that's just your uterus practicing getting ready to do its big job. And if you're sitting there thinking, Hilary, this is so much new information, like I didn't know this, I want more information, I cannot encourage you more to come join a great high quality birth class. I host the online prenatal class for couples. It truly is the easy way to get prepared for birth. In just 3 hours, we get you prepared, not scared, for that hospital birth. It has all the information that you need in one spot, and I think you'll be surprised at the price point. When you go to check it out, and I'll put the link down below, be sure and look at the reviews, because there are hundreds of great reviews for that class about people who it have helped, and I know it can help you too. Now, like I said before, contractions seems to get top billing in the whole labor scenario, but there are other signs that you should be watching for. I'm going to put the link for it right here.